96.1 FM. I mentioned earlier that at 4:30 it'll be time to join me on Health Insurance Today on radio. And of course, here we are. Welcome to this week's edition of Health Insurance Today. Of course, Health Insurance Today on radio, the show that educates and brings you the latest information on everything health insurance. This program is brought to you courtesy Sister Communications Limited, and I am your host, Taiwo Barua. Last week on the show, we discussed the topic, the silent killer, understanding hypertension, during which a cardiologist educated and enlightened us about hypertension, its management and prevention, and how having a health insurance plan can help to, handle a bit of a more cost-effective way of managing the condition. And we thank you for your calls, feedback, inquiries about that episode. We hope to, of course, we hope you learned one or two lessons from that edition. On the show today, we shall be discussing My Health Insurance. That's a story and, of course, a testimony of a user of health insurance, which is an opportunity for a subscriber to share his story on having and using a health insurance plan. Our guest is right here with us in the studio and is going to be sharing his real life story and also enlighten us on health insurance. Remember that you can be a part of the conversation. You can call the studio line on 0915-387-7127. I'll take that again, 0915-387-7127. You can also send a text or WhatsApp platform just if you're not able to reach us via telephone call. That'll be on 0809-9120-777. Here by sending a text to our WhatsApp platform. I mentioned earlier that my guest is very much with me in the studio. I have Adewunmi. He is a director of organizational development at AT Limited, a human resource consultant and marketing services firm here in Lagos. Welcome on board, Adewunmi.
Hi, thank you. Thank you for having me.
All right, good to have you in the studio. Can you tell me a bit more about your background, how you decided to, tap into health insurance? What prompted that decision for you?
Well, health insurance to me has not been new. It has always been something that I know since my university. Fortunately for me, the school I went to, it was mandatory to pay an health insurance at the beginning of every session.
Oh.
Yeah, so once you pay that, no matter what sickness you have, you just go to the school clinic and you get treated for immediately. So that was the first introduction to health insurance. At first, when it happened, I was like, what are we paying this for? But along the line during the session, when you see that you need to be admitted or something, and you see how you don't have to be bothered about whether you are broke at the end of the month or something, whether you don't have enough money, you get free medicals. Not necessarily free medicals, but you get taken care
covered.
Of. Yeah, you get covered completely for whatever ailment it is that you have.
All right then. So tell me, what type of health insurance plan did you subscribe to? And is it a government scheme or a private HMO plan? And how long have you been a subscriber to it?
So I've been since 2010. I've been a subscriber to, but they've all been private since 2010. From school, it was always private. From when I started working, I think I started working in 2015. It has always been private. I've always had the opportunity to use HMOs. Let me just put it like that, HMOs. So it's always been private, and till today, to this moment, I still use them.
All right then. So does this plan cover just you or your family members? And how are these family members related?
Well, at the moment now, the plan I'm using right now covers me and my wife. But before I got married, it was just me. Like you said, I am the organizational development of an HR firm, so I have HR experience.
Okay.
And my HR experience, I've worked as an HR in an organization before, for a long period of time, and I've seen people that it covers their family, it covers just them. Some people even want it to cover like their, let me use the word, not their husband but the father of their baby, because they don't have the same surname.
Okay.
Yes, but they want it. That's how important it is.
Okay, that was why I asked you earlier that what's your relationship with those it covers for you. I just wanted to have an understanding of how it works. Do you have to bear the same surname with the person you're bringing on board?
Well, it depends. The truth is that it depends on the organization, or it depends on if it's just you're the one who's going to subscribe on your own. If it's from your workplace, most of the time your work might demand that the person that you are adding to the HMO plan, there's a proof that the person is family.
Okay.
So I just don't have any random
person. Yeah. All right, then, since you subscribed, then what specific service have you, your wife and children enjoyed on your health insurance plan?
I've enjoyed. I don't want to say enjoy because nobody prays to be sick or anything like that. But I've used the service. Like, I'm someone that, like, let me say, I abuse health insurance plan.
Oh, wow.
Let me use that word. Like, if I sneeze like this, I'm going to the hospital. Yeah, I've used it to get glasses.
You're not abusing. You're paying for it.
Yes. What I'm saying is that I don't. I like. If you talk to my current HMO officer that is handling me, she'll tell you that she's tired of me because I call her every time, like, oh, I need to go to the doctor today. Oh, I need to do a checkup. Like, I do monthly checkups. I do the regular checkups, obviously, but it's not monthly actually. It's like every 3 months I do a checkup. My wife does her own checkup also. I once had an injury about 7 years ago in my hand that required surgery. It was HMO that covered it. And that's been the experience with HMO for me.
Okay, for some people now, it's not a necessity for them. Can you share with us a time or experience when your health insurance plan really made a difference for you, your family? I mean, that made you realize the value of this health insurance plan?
Okay, so I want to address, I think you asked two questions in a way. I want to address people that I think is not necessary. It's extremely necessary. One of the reasons why it's necessary is because of the economy that we have today, the economy that is not very stable, if I must say. So once you are able to pay for it, you don't know if at a particular point in time during the course of the period that you've paid for, if you might have enough money to cover your hospital bills when you come in with a particular sickness. But if you've paid already, you can just go in and then you get treated for. I won't share a personal story, but it's not me directly, and this is just recent. My cousin passed away about last week, which is quite sad. And the unfortunate thing about it is that, assuming he had healthcare plan, he won't have died. It's as simple as that, because he was self-medicating. And assuming it was because of, I don't have enough money. When we got to find out, like, they were self-medicating, calling all these local nurses in the area to give them drip and all of that, and not going for the right and proper checkup, that's a life that was lost due to just not subscribing for health insurance, just to be able to take care of yourself and look out for yourself. For the other question, sorry, can you come again for the other question?
Yes, I asked if you could share an experience.
Yes, that's basically the experience. Yes. Because for me personally, I just like I said, I've been using it. So I've been using it for it's part of my lifestyle. That's it.
Okay, I have a message from Sheson here. Thank you so much, Sheson from Bariga. And I think it's one of the reasons why a lot of people do not even want to tap into health insurance. They would rather walk into a pharmacy to purchase anything they need. It's a case of how they get treated, how they get approached when they walk into any health facility. Have you ever had that experience, just basically because you fall under health insurance plan, then you walk into a hospital, they tell you, okay, just calm down, let's attend to these people first, and then we'll attend to you later. Have you ever experienced that?
Yeah, true that. I won't say I've not experienced that. I experienced that during maybe this was like 2019 or so. That's when I started working in a particular organization, and I got this new health insurance company that they subscribed me to. And yeah, when I got into the hospital, they told me that I got a bit delayed than, but the truth of the matter is that that's not on the healthcare. That's on the hospital. Like, it's the hospital. It's just
that's the hospital, not the health, not the healthcare provider. All right, then. So I like the fact that you put that clause there, that clarification there. So Lagos, if you feel dissatisfied about health provider, their service or anything, you can actually reach out to your health insurance provider and then lodge a complaint. If you need to change your healthcare provider, you can go ahead and change. Lagos, Nigeria, you can be a part of this conversation just by putting a call through on 0915-387-7127. If you're not able to reach us via telephone call, please send a text to our WhatsApp platform on 0809-9120-777. But then ensure you're not the one behind the wheel if you have to do this, okay? All right, then, moving on now. So, before you subscribed, did you have any doubt about health insurance and how were you able to, how were you convinced, or who convinced you on the need to tap into health insurance?
Well, like I said earlier on, I've been using it since I was in university, and that was a long time. But the funniest part, even before university, I'd not been using it, but I did not really understand it, because when you watch movies and then you see in the movies that maybe someone is sick or someone has an accident and they rush them to the emergency unit. These are like foreign movies, and then you hear the doctor or the nurse will say, "Do you have insurance? Do you have insurance?" And I used to be like, "What does this guy mean? Do you have insurance? Like, do Americans subscribe to like some type of health insurance?" I didn't understand that, but when I go to school and I understood that, okay, this is how it is. This is what they mean by when do you have insurance? Because you just go to the clinic and then do you have insurance? But in Nigeria, when you go to the clinic, they ask, do you have HMO? That's how it is now. We should go to any hospital. Like, I went somewhere because of my cousin that passed away. I went to my family house and I had to go. I was sneezing. Like I said, I used my healthcare very well. I was sneezing, so I went to an hospital that I've never been to before. Yeah. And they're like, "Do you have HMO?" And I was like, "Yes." And they just had to send a mail to my healthcare provider, and that was it. And I was treated with ease.
So, how did having health insurance plan affect the cost of your treatment in hospital?
It's a breeder. Let me just put it like that. It's a big breeder, because I've never bothered about like, oh, how much is this doctor going to charge me? What's wrong with me? Okay. What's happening? How much am I going to spend? Like, the amount you might, although because personally right now my healthcare has been taken care of of my organization, so I'm not feeling it. Like, it's not coming out of my pocket personally. So, but at the same time, if I was talking to an individual that is not with an organization and maybe is a self business owner and things like that, I'll suggest that it's something that you prioritize for yourself. Like, you put it as when you're calculating your cost of living, you should just put that, okay, you are going to pay, I think for if, can I give an amount?
Yeah.
But I think that for a yearly plan that is very good, if I'm not mistaken, you can get a yearly plan for about 200,000 naira.
That's fair enough.
Yes, that's fair enough. That's very fair enough. And then you can also meet with the HMO people, and then you can cut it down to maybe a month. And there are cheaper plans than this one I just said. But I'm just saying the one that takes care of a lot of things that they're not going to be telling you that, oh, their healthcare can't take care of that. So in other case, there are some plans that are very limited to just like the basic sickness like malaria, typhoid, and all of that.
Don't call it basic.